Welcome. I'm Dr. Linda White-Ryan, and this is Module 2 of the Licensing Preparation course that I am developing for all of the graduating students and alumni at Fordham University Graduate School of Social Service. So today, Module 2 is covers one of the content areas: human development, diversity, and behavior in the environment. So 28% of the licensing exam is devoted to this area. And so what we will talk about today are some of the theories and some of the other concepts involved in human behavior. So what do we know about theories? Well, we know that theories explain and predict, and they're also supported by scientific evidence. A human behavior theory may explain how human beings interact with one another or react to certain things in the environment. In the social work profession, we understand how important the environment is and the exchange of energy between the person and the environment and vice versa. And so it's really critical that you have a basic understanding, because remember, the licensing exam is about evaluating your basic level of competence to practice your profession. So having an understanding of the various theories is important in order to answer the questions on the licensing exam correctly. Having said that, I will name some of the theorists connected to the theories that they developed, but in most cases you will not see too many names used on the LMSW exam. So let's first talk about system levels. In social work and in human behavior, we talk about the different levels of society. So microsystems is the smallest unit of analysis. In most cases, that's the individual. Mesosystems are usually small groups in which individuals are involved. So that could be family, friendship groups, work groups. And then you have macrosystems, and that's your largest unit of analysis. Society, culture, social institutions, communities, and organizations would be included in macrosystems. Ecosystems perspective is very important to the profession of social work. We talk about utilizing an empowerment perspective, and human behavior studies the ecosystems of life and their interconnectedness. As I mentioned, there is a connection, an exchange of energy between the environment and the person. One influences the other and vice versa. So when we think about this interconnectedness, we think about a metaphor of the whole the whole person. Environment in the person as well as person in the environment. This is the grounding of a lot of the models and perspectives that we use in social work. So the ecosystems model is a combination of systems, concepts, and the ecological framework. Systems approach was developed actually as a reaction against the dominance of Freudian theory. And it is more holistic, focused on interaction among the parts that make up the whole. So the interactions in a family, the interactions between people in different groups and systems. And it was brought to scientific prominence in the 1960s, as I said, as a reaction to against Freudian theory. And it serves as a bridge between professionals from different fields. So what systems and ecosystems did, especially system, was on an interdisciplinary level. It gave the different disciplines a common language to think about how to approach the different systems involved in society. The ecological approach, called the Life Model, was developed by Germain and Alex Gitterman in 1980, and then it was a textbook called the Life Model, and they rewrote it and added to it in 1996. And what the basic focus was the notion of adaptation of the organism to the environment. And this became very, very important in advances that were being made in the field. So the systems model focuses on roles, and ecology focuses on the setting, the habitat, the environment. Very, very important. The combination of systems theory and an ecological interactive perspective is really something that is well used in the field of social work. It's a model for describing human interaction, and it views organisms, all of us, in constant interaction and considers this interaction and people as interdependent on one another. Not dependent, interdependent with each other and the environment. So there's that, again, exchange of energy between people and the environment. Social work is concerned with sustainability today. So sustainability is a term that we hear a lot in environmental science, but in many, many fields, and it has found its way into social work for a very, very important reason. And so given the economic and environmental crises that we all face today in society, it's very, very important. So social workers link with social welfare programming for the benefit of their clients. However, in order to be effective, it depends on the external financial support that is received to keep these programs going. So some of the key ecological concepts that we think about in ecology, one of the terms is transactions, and that's the interactions between people and others in their environment. Energy is borrowed from systems theory, and it refers to the power that comes forth, that springs forth, and takes the form of output or input, what I take in and what I give out, depending on the direction of the energy. And when we think about and learn about eco maps, we often look at energy and what's coming in and what's going out. And also the other term that is important is targets of change. And what do we mean? The source of social work intervention. And this could be individuals, groups, or whole communities, organizations, families. So targets of change. Back to sustainability. It's an important concept that we have added to ecosystems as a means of assessing policies and practices that very much are involved with the clients, families, communities that we serve as social workers. And the definition, meeting present needs without destroying resources for future generations. And this is important for all of the resources and programs that we use to help the people that we serve. So are the present environmental practices that we have in society sustainable for the future? This is what needs to be looked at. As social workers, we too need to focus on sustainability. Environmental sustainability is also economically sustainable in preserving resources for all in society. What are some of the contributions that the concept of sustainability has made to social work? So one of the important ideas that we think about is that person and environment are in constant and dynamic interaction, and it's a non-linear view. If we think about family therapy, that also borrows from ecology. Roles individuals play in a family are seen as complementary and interactive. Again, that exchange of energy. And this insight, when you think about it, is also very relevant to group work, which we'll talk about in a few minutes. And so what are some of the advantages? Well, it provides the ability to analyze circular connections between worker and client, places value in assessment and the integration of all of the other social work theories that we think about. What does this teach social work, the profession, about human behavior? So when we think about all of this, we think about the concept of adaptation in assessing the goodness of person and environment fit. So the goodness of fit is really very, very important. Or how well can people cope with the stressors in their surroundings? And this can really serve to locate points of oppression and the need for structural change to provide personal growth and development for the person, as well as getting all of the basic needs met. So the notion of sustainability really provides insights and accountabilities for the policies that are developed and that serve the people that we work with, all of the people. So let's think about systems theory. Well, the whole is more than the sum of its parts, is basically what it means. There are open and closed systems, and an open system conducts a steady state of exchange with the environment. So it's steady, it's consistent, and so there's input of energy and output of energy. It's open and it's flexible. A closed system is shut off from the environment. So therefore, you're not able to take in or influence the environment, and it's much more rigid and inflexible. Increasing differentiation from specialization from single cell to entire organism. So the influence of one to many and back and forth. And the boundaries of the system are also considered, and healthy boundaries are firm, so they're delineated and firm, but they're also flexible. And systems theory looks at causality of whatever as nonlinear and interactive. So systems in which a social worker must be involved in their practice, certainly the client system is people who sanction or request services. The people who are the beneficiaries of the services we provide as social workers, and those who have a working agreement with the change agent. And again, social workers are the change agent. We're agents of change. And so the target system, again, is the people or things that need to be changed in order to accomplish the goals that are developed between the social worker and the client. And the action system means the change agent and individuals that help accomplish the goals. So we want to keep all of that in mind when we think about systems theory. Now, when we move to family systems theory, which is something that as practitioners of social work we use very often, and again, we view families as systems of interconnected and interdependent individuals, none of whom can fully be understood in isolation from the system. What do we mean by that? Well, if you think about a family and you are working with one person, let's say, in that family, people do not live in a vacuum. They're part of systems, and a family member is part of a system. And again, if you have an open family system, it's a healthy system, and if one of the members requires assistance, they can move out of the system and then come back into the system. If the system is closed, it's much more rigid, and a member requiring assistance may be stuck, may not be able to leave that system. But so the basic concept is that you cannot understand, in family systems theory, you cannot just look at the individual. You need to look at the whole system and what is going on in that system. So each family is a system and is more than simply a sum of its individual parts. Families always strive for homeostasis, so looking for that balance. And very often, so if you have a functional family system, that means that it's open, as I mentioned earlier, and flexible. If it's a dysfunctional family system, it is more closed and rigid. And ways of operating, whether functional or dysfunctional, are the grounding for the way the family operates, and the family will always strive for homeostasis. So if they're used to being dysfunctional, that they may stay in that state, and part of the work of family therapy is to shift that system. Boundaries occur at every level of the family system and between the subsystems. For instance, subsystems in siblings. So there's boundaries, and it occurs at every system. I mentioned Maslow in Module 1 and Abraham Maslow's self-actualization theory. And Abraham Maslow developed what he called the hierarchy of needs. And I want you to keep this in mind when you're taking the licensing exam, because health and safety needs first, and this is the level right there of what you want to think about for people. Physiological, physical needs come first. Food, shelter, clothing, all of that is most important. Safety needs, environmental safety might be safety in a neighborhood. Safety in general, health safety, physical safety, emotional safety. That is next in the hierarchy. Belonging. Belonging and feeling loved and cared about is very, very important. We know small children need to feel that affection and that sense of belonging. Then comes esteem and eventually self-actualization, where people are they've been able to move through the hierarchy and reach their highest potential. And so most of the needs have to do with survival physically and emotionally. First and foremost, most important. The hierarchy needs of esteem and self-actualization cannot be met until lower order basic needs are satisfied. So that when you are approaching the questions in this exam, it's really important to think of this hierarchy when you're answering the questions. Because if a person needs services for shelter, or to obtain food, or to have financial services for food, then it's really important to remember that comes first. So you're always thinking about Maslow's hierarchy. Family therapy, we talked about family theory, and the family is the unit of attention for assessment, diagnosis, and treatment, and is not only for the individual. What do we mean by that? Well, we can work with a family, and the client is the entire family. It's not just one person, even if the person is the identified patient, meaning let's say a child is referred and the whole family comes. You think about the family as a system. However, individuals go for family therapy as well. And so again, we come back to the individual does not live in isolation. Even if they're an adult and they're no longer living with their family of origin, always those influences of the family remain with us and are very, very important. And you can do family therapy with an individual. So it's important to remember that. And the goal is to interrupt circular or dysfunctional patterns of communication and replace it with healthy patterns of communications. Genograms and echo maps can be can really be helpful in determining, looking at family therapy. Thinking about a genogram, you look at the intergenerational patterns of communication, stressors, illnesses, and what influence it's had. So they can be very, very helpful. There's a type of family therapy called strategic family therapy developed by a gentleman named Salvatore Minuchin. And it was in the 1960s, and what Minuchin saw was that a lot of the family therapy that was being used at that time was aimed at middle-class white families, and what he was doing was working with young people in Harlem, and he was seeing of lower socioeconomic families, and he was seeing a different need. So he developed what he called strategic family therapy. And what the therapist does here is initiates and designs a specific approach for each family member's presenting problem, and then takes responsibility for directly influencing change, so that the therapist is more directive in this type of therapy. And he talks about first order changes, which are superficial and do not change the system. However, he begins with that, but second order changes are really what is considered important, and it addresses the interactions between members of the family and reorganization of the system, which he feels is critical. And you may also see something that's called paradoxical directive. So if you have a question on the exam about paradoxical directive, this is about prescribing or emphasizing symptomatic behavior. So almost encouraging one of the members of the family who is symptomatic to increase those symptoms for a period of time, and really looking at the resistance to change in order to help the client change. So you almost bring it more to the surface in an attempt to change. This is what Minuchin believed. Structural family therapy, as we continue to look at it, stresses the importance of family reorganization and the functioning. And very often what Minuchin said he found is the parents were the children and the children were the parents. So he looked at the structure and felt that was important. And the social worker joins in this type of therapy with the family in an attempt to restructure. He did a lot of role plays in which the therapist actually joined the system. The boundaries in the system are explored. Some of them were very, very weak, some rigid, and he explored those with the family. Hierarchical organization. The hierarchy in the family is examined. What are the parents' roles? Differentiation, rights, and obligations. So looking at the different roles of family members, and then working on restructuring. And the way he did this was to observe what was happening in the system, and then to manipulate interactions by performing in these role plays actual enactments of situations that were happening in the family system to effect change. Then we have Murray Bowen, who developed Bowenian family therapy. And the goal of this type of family therapy is not symptom reduction. The focus is really on improving intergenerational transmission process, multi-generational. So think about this. I mentioned genograms, and in family therapy, especially Bowenian family therapy, can be very helpful to use a genogram to look at, try to go back 3 generations when possible, to try to look at what are some of the stressors, the methods of coping or patterns of coping with stress that have come down through the generations. And so that's the focus of looking at that. Murray Bowen talks a lot about triangles, and in triangles there are usually 2 people who are in harmony or agreement, and 1 person is in conflict. So very often in a family, let's say 2 parents and a child, it's the child that the parents are agreeing. If the child would only do better, if his grades were better. Very often what's happening is there's actually an issue between the 2 members in harmony, and the child becomes what we call the identified person. So he talks about triangles. Family projection process, which is the transmission of emotional problems from a parent to a child, is talked about. Multi-generational transmission, and that's the patterns and emotional coping mechanisms from one generation to another that I mentioned earlier. And most of all, Murray Bowen talks about differentiation of self, the ability of individuals to not need to depend on other people for acceptance and approval. So that in a family, I can become different and still be part of my family system. I can believe differently, and I don't need the approval of mom and dad to feel okay about myself. So those are the main foci of Bowenian family therapy. Then we have problem-solving therapy. And it's very task-centered and it's short-term. Change occurs through supporting clients to take actions that address the problems in their lives, okay? So I want to just say a word here. If a client needs to be functioning at a certain level for this to be helpful. So somebody who is in crisis, a total crisis situation, this might not be the best approach of working with them. But it can be very effective. It is short term, and the focus is really helping the client to find the problems and the goals, of course, always in collaboration with the social worker. The analysis of the problem really leads to the consideration of what actions do need to be taken to solve the problem. And the change actually happens as a result of the actions taken for problem solving, or the tasks that the client and the practitioner decide on. But a lot of the work takes place outside of the session versus some of the psychodynamic theories. It takes place out of the session. So that is problem solving, task-centered therapy. Then we have Gestalt therapy, and it was developed by Fritz Perls in 1969. And this is about, and only about, the here and now. The only thing that matters is right now, present time, and the client must take responsibility for what's going on now. The use of I language is used, and we do not ask why questions. And one of the things that Gestalt therapists make use of quite a bit is the use of empty chair exercises and role plays. They find these to be very, very helpful and important for the client to achieve changes in their lives focused on the here and now. So you may notice that I'm going over the theories and we're just going through the basics. When you review for the exam, the study materials that I've mentioned, so you make use of the modules. You can go back and review the modules since it's all online whenever you want if you see something that you're reading in a study resource. But these are the basics, and again, the names are not as important, but I just want to make sure that you have an understanding of the basic concepts for the exam. Group work is a big one, and there are usually a number of questions on group work. And what is it? Well, it's a method of working with people in groups. It could be for personal growth, the enhancement of social functioning, and really for the achievement of socially desirable goals. There is a term that you might see, not everyone sees it on the exam, and it's called groupthink. And groupthink really means a group that makes faulty decisions because of pressures from members of the group. And so you want to remember that term. And groups that become affected by what we call groupthink really ignore alternatives and problem-solving techniques, and they tend to take irrational actions that dehumanize other groups. So you could see bias, you could see prejudice, oppression, so those kinds of things. Just a term, not everyone sees it, but I wanted to make sure you had at least heard it. So group work. Clients are often treated in group settings. Most especially substance abuse clients are very often, because truly group work is the treatment of choice with substance abuse. Insights about the client can be gained by observing the client's behavior in a group setting. And group therapy can be a device for affecting individual change. Even though it's done in a group, each group member can affect positive changes in their life as a result of the exchange of energy among group members. Irving Yalom wrote a book. He is our group guy, and he wrote a book called The Theory and Practice of Group Psychotherapy. And what does he describe? He talks about some 11 primary elements. I have not mentioned all 11, but I picked out the ones that I thought were important. Installation of hope. Groups can be very beneficial for instilling hope in people, helping them to know that there is hope for the future, and universality, meaning that you are not the only one. We're all in the same boat. You are not the only one that things have happened to. It also can be psychoeducational and imparting of information. There's something called, in psychodynamic groups, called recapitulation of the primary family group for correction of certain behaviors. So what do I mean by that? What recapitulation means that I am a member of a group, and I may have some, as a result of the work that's done in the group, there may be members of the group that remind me, I may not be aware of that, of people from my past. In this case, family members, my family of origin, which is your primary, your mom, your dad, your siblings, or grandparents. And it may bring up feelings from the past, and it's called recapitulation. I have an opportunity in a safe, supportive environment to work through those issues that I may not have had the opportunity to work through in my family of origin because of whatever reason. So that can happen, and it can be very, very helpful. Also, imitative behavior. When I see people treating other people in a certain way, I may begin to imitate it. Interpersonal learning, learning about myself and developing a level of self-awareness, seeing things mirrored toward me from other people in the group. And group cohesiveness. Maybe I came from a family or have been part of groups where there wasn't that cohesive nature of the group. But a good working functional group can teach someone about the power of group cohesiveness, and certainly catharsis. A safe, supportive environment, feelings can come to the surface, and I can share my feelings, and they will be, people bear witness to each other's feelings in a group. And so, especially if it's a safe, functional group, this can be very, very helpful to people. So some of the processes that are involved in group: transference. I transfer onto someone. It's unconscious. I may not be aware of it, as I said earlier. Traits of a family member and a person within the group. You may see certain group members acting out in a group, and the group can address it as a whole. There are scapegoats in groups at times, and it's very important to identify someone who's being scapegoated, but that may have been their role in the family, and the group may begin to scapegoat a certain member, and certainly the group should address it, but the facilitator of the group as well. Open groups, you should know these terms: open groups and closed groups. Open groups are constantly changing, such as groups for substance abusers. So you may have an early recovery group. People come in and they go at different times. They come in, they do their work, they move on. And people, it's open. People can come in and out. Closed groups are groups where group members begin and end together. So the group is closed. So you start with a group, and hopefully everyone stays. Commitments are talked about. However, no one else can come into that group. So that's called a closed group. And in thinking about group work, the most important thing that I can say is right here. And so when you're working within a group, always bring it back to the group to address, unless it involves mandatory reporting or danger to self or others. For example, if a group member is continually leaving group early or missing group, then let the group members address it. You do not need to address it as the social worker. The group will take care of it. So that, remember, if they ask you a question on the licensing exam, what do you do if a client is coming habitually into group late? It's not what you do. It's really what the group does. Allow the group to take care of it. And the exception, of course, is if a client is in crisis or that is suicidal or threatening to harm someone. That's different. If there's mandatory reporting involved, so there are exceptions. But in general, allow the group, bring it back to the group. What does the group think? You know, what are members of the group thinking? So let's talk now about psychodynamic theories. There are many psychodynamic theories, but the common thread that runs throughout all of them is that they emphasize unconscious motives and desires. Some of the theories, the more famous theories, are drive or structural theory, also known as psychoanalytic theory, ego psychology, object relations theory, self-psychology, and relational theory. And what these theories do is they all focus on the importance of our childhood experiences and what happened to us in childhood in shaping the personality. Psychoanalytic theory was developed by Sigmund Freud. We've all heard of Sigmund Freud. And this treatment, his treatment focused on dealing with the repressed material of the unconscious. According to this theory, personalities evolve because of an attempt on the part of the unconscious to resolve unconscious sexual and aggressive impulses. and the demand on society for all of us to be able to contain and restrain these impulses. What's really important to know for the LMSW exam is that Freud proposed 3 components of the personality. The first was the id. The id is the raw, primitive impulses toward survival, sex, and aggression. It operates according to what we call the pleasure principle. And it tries to avoid pain and achieve pleasure. Then the second is the ego. And this is the great mediator. It manages the conflict between the id and the superego. And then we have the superego, which is really the moral component of the personality. And this is what causes us to feel guilty when going against the accepted norms and rules in society. One of the things you want to remember is that if we were all id, we would be all raw, primitive impulses. If we were all superego, then it would be difficult to even function due to all of the guilt. But when you look at all 3 and you focus on the conflict management provided by the ego, it all seems to make a lot of sense. Freud developed what they call psychosexual stages of development, and his theory was that if all of these stages were completed successfully, the result was the person develops a healthy personality. However, if some of the conflicts are not resolved at the certain stages, what he called fixation can occur. And what we mean by fixation is the person gets stuck in a certain stage. So fixation is a focus on an earlier psychosocial stage, and not completing it, as I said, the person becomes stuck. For example, if you have a person who's fixated at the oral stage, they could be considered to be overdependent on others and could seek oral stimulation and satisfaction through smoking, drinking, or eating. That's an example. The oral stage is from 0 to 18 months, and it's one of the 5 psychosexual stages of development. And the pleasure here is centered around the child's mouth. And it's the initial stage, it's the first stage of development. And what Freud said about this is that when infants will be found putting anything into their mouth, including their thumbs, this would be what you would see as part of the normal stage of this development. Then the child moves on to the anal stage, which is 18 to 36 months. And it occurs, as I said, in the second year of life, and the focus for the child is on sexual gratification. And the child begins to find sexual pleasure in the sensations of his or her own body that come with withholding bowel movements. And so this is a stage, again, of development that the child is expected to move through, or the person can become stuck in that stage, or fixated. The phallic stage is between 3 to 6 years of age, and the pleasure center is the pleasure sensations are centered around the genital region. The phallic stage is the 3rd stage of development, and as I said, occurs between age 3 and 6. This is the stage where the child learns that there is a difference between males and females. There's something that Freud called the Oedipus complex, and it occurs during the phallic stage and is a conflict in which the boy wishes to possess his mother sexually and perceives his father to be a rival in love. According to Freud, and this is not all theorists believe the same things, this was Freud's belief, and he wrote a lot about it. The child must eventually give up his sexual attraction for his mother in order to resolve this attraction and move on to the next stage of psychosexual development, or again, he could become fixated. Failure to do so could result in trouble for the child as he moves on in life. The latency stage is years about 5 or 6 all the way till puberty. So it's quite a longer stage. And a child's sexual impulses during this stage of development are repressed. And the reason for this is that the stage before, the phallic stage, the child resolves the Oedipus complex successfully, which are such traumatic events that the child then represses all of his or her sexual impulses. The genital stage is actually from the stage of puberty onward. And the genital stage is the final stage that, in Freud's theory, that he discussed. And the teenager has overcome latency and really has begun to make associations with one gender or the other, and now seeks out, after having repressed it in latency, now seeks out or begins to seek out sexual pleasure through contact with others. And the sexual contact sought has shifted from the opposite sex parents of the phallic stage, and overcoming this, it is now focused on the opposite sex people of similar age. And we know that modern theorists would say that also it could be same sex of the same age. But Freud, that's not where Freud was. So it's important for us to know that, there's no one psychodynamic or any theory that has it all right. But it is important for us as social workers to understand, and certainly for purposes of the licensing exam, you do not need, and I want to emphasize this, you do not need to memorize every single theorist, every single theory. You want to have a general understanding. As far as Freud, it's unconscious, sexual, and aggressive impulses, but mainly the id, the ego, and the superego. Now let's talk about self-psychology. And this defines the self as the central organizing and motivating factor in the personality. Hans Kohut really evolved self-psychology concepts, and many have gone on to further his work. Self-esteem and sense of self-dependent on quality or relationships with parental figures was very important to this theory. And the self-object is the person who is experiencing feelings intrapsychically. And the self-object must be available to the infant for its development of self. So what do we mean by that? What we mean is that the object of the child or the infant, a parent, a major caregiver, needs to be present in order for the infant to develop his or her sense of self. Mirroring is seen as very important, and that validates the child's sense of being okay as they are, or as they said in self-psychology, the perfect self. So you know that when a parent or a caregiver mirrors to a child, the child, that's a template. The child looks into that mirror to see, am I okay? Idealization, the child borrows strengths from others and identifies with someone more capable than themselves. That would be the adult, the caregiver, the parent, and so on and so forth. Ego psychology. After Sigmund Freud, a lot of psychoanalysts, most responsible for the development of ego psychology, decided they would increase a different focus in psychoanalytic theory. So some of these people were Anna Freud, his daughter, Heinz Hartmann, Margaret Mailer, and Erik Erikson. And ego psychology focuses on the rational conscious processes of the ego. So we know that it's very important for us to work with our clients on developing ego strength, that sense of self, grounding in the self, and a sense of self-esteem. So, and that goes on to help the person develop coping abilities. And so ego psychology talks about all of this. And the goal here in self-psychology is to maintain the ego's control and to manage the effects of stress, because this is important in the person's day-to-day life and how they are able to handle things on a day-to-day basis. Erik Erikson developed what we call stages of psychosocial development. He developed this in 1950, and there were 8 successive stages that he talked about. And what it addressed was the bio, the social, the situational, and personal influences. So he did not look as much as Freud did at the unconscious. There were some unconscious involved, but he looked again similar to Freud of the person needing to move through various stages. However, he looked at the biological, the social, and even the environmental influences on the person as they grew and developed into an adult. And he talked about what he called crisis, and that each person would have to adapt and cope in certain ways or in maladaptive ways with certain tasks in all the different developmental stages of the lifespan. He also looked at strengths and characteristics and beliefs that derive from successful resolution of crisis in each stage. That is how the person develops strengths. We focus a lot in social work, we work from a strengths-based perspective, that each human being has strengths that we want to build on. They have resources within themselves, and the environment also has resources. And what Erikson believed was that successful resolution and moving on to the next stage of development actually helped a person build strengths. So just briefly, the 8 stages of psychosocial development, Erikson's, are trust versus mistrust, birth to a year. And this is the time when basic trust develops when needs are met. Good attachment comes from this, meaning that the baby, the infant's needs are met on a regular, consistent basis. It doesn't mean it's perfect, but that their needs are met. The second stage is called autonomy versus shame and doubt, and that is 1 to 3 years old. And this is when the child begins to be able to do some things for themselves, pull them up, walk. The development of physical activities is seen here, such as walking. The next stage, the third stage, is initiative versus guilt. And this is about 3 to 5 years old, and this is when preschoolers begin to learn to initiate tasks. A lot of children go to preschool at this time, and they become more independent as they move along. And fifth stage is industry versus inferiority, 6 years to puberty. And this is when the child begins to follow through and complete tasks, and they begin to learn some things on their own. And remember, the focus of Erikson's work was that you need to be successful in completing a certain stage, or you're not able to go on successfully to the next stage. You get stuck in one of the stages of psychosocial development. The sixth stage is called identity versus role confusion. And this is adolescence through the early 20s. And we all know about adolescence, and here's when the adolescent begins to define their sense of self. They're looking for independence and autonomy in finding out, who am I? Who am I separate from my family? And they do a lot of testing of new roles and incorporating them into the identity that they're developing. Also, they take risks in this stage of development. And if an adolescent is not able to successfully master this particular stage, this particular crisis, as Erikson would say, of adolescence, then they get stuck. So stage 6 is intimacy versus isolation, and these are the early adult years, 20 to 40s, and this is when people develop intimate relationships and they begin their own families. They may begin their own families, their careers get launched, and they can move through beginning a career and moving on to become successful. They may even reinvent themselves as they go along career-wise. Seventh stage is generativity versus stagnation, middle adulthood to the 60s. And middle age discover a sense of contribution to this world. what have I brought to the world? What is my unique contribution? Family and work often satisfy this desire, so it doesn't need to be. My contribution may be having my family as the center, and what is my contribution? Or it could be in a career, it could be in volunteer work. There are many different ways. And supporting and satisfying the future generation. How have I contributed to the future generation? And the final stage, according to Erikson, is integrity versus despair. And this is late adulthood, 60s and beyond. So we know that the fastest growing segment of the population is 85 and above. However, this is, at the time Erikson did this, 1950s, this is how he defined it. And this is a time when a person reflects on their whole life. And did I contribute to the world? So this is when he says integrity versus despair. He does not mean integrity meaning honesty. He means the ability to reflect on my contribution, and even on times that have been hard or where I may not have been doing well. I don't despair over that. I am able to make sense of it. I'm able to look back and say everything I went through brought me to where I am, and to look back and see some of the positive aspects as well as any of the negative aspects, rather than falling into a total state of despair. Now, let's talk about object relations theory. And the focus is on the development of the personality again. And the caretaker here becomes the object that nurtures the infant's attachment. Without attachment formation, infants can die. Attachment is critical. And the personality is formed through this interaction with the primary caregiver as well as with other people. The need for relationships for all of us throughout our entire lives is at the center of personality development. The major theorists for object relations theory was Melanie Klein, D.W. Winnicott, Douglas Fairburn, and Margaret Mailer. I'm sure many of you have heard about Winnicott. Winnicott talked about the good enough, he said mother, I'll say parent, the good enough parent. And what that means is attachment is critical. However, also there are no perfect parents. So he coined the term, the good enough parent. So always keep that in mind when you're thinking about object relations. And it looks at the relationships between and among people. It examines how the history of interpersonal relationships from early on, infancy on, are transferred from the past into the present. And what that means is what happened to me very early on has an effect on how I will get along in the world with other people, what my relationships will be like with other people. So that the relationship with the primary caregiver is looked as critically important. And that could be, it should be always to think about defining it culturally and ethnically, and it could be a mom, a dad, grandparents, extended family, and please let us not forget about community members who actually can step in to be caregivers when the child is in need of that. Community is critical. So that's what object relations theory said. And now let's talk about attachment theory. John Bowlby developed the theory of attachment. And what this theory really stresses is the importance of the child developing in relationship to the context and the environment. The child impacts the environment, and the environment impacts the child. So what is that very similar to? In social work, we talk about person and environment. And Bowlby recognized how important the environment was, and that it had an impact on the child and vice versa. So we know that fluid dynamic exchange of energy was really recognized by John Bowlby early on. And he talked about 4 different attachment styles: secure, anxious, resistant, anxious, avoidant. So what you can do is review some of those. You don't need to memorize them, but knowing that attachment is critical to the developing person and that primary caregiving situation is very important. And without any attachment, an infant runs the risk of dying, actually dying. And you've heard stories about this in cases where children were abandoned and there was no one to really care for them. Securely attached children, we know, are able to successfully separate and individuate, which is really important in life. So we are attached and we are dependent, and then we go on to separate and individuate in life. Behaviorism. All species of animals learn in similar and equal ways with the same guiding principles, according to the behaviorists. To understand learning processes, you focus on stimulus and responses. The internal process should be excluded from the study of learning, according to what the behaviorists say. Learning is evidenced by a change in behavior. So, when we think of behavioral theory, there are some different definitions that go along with it. An operant model of conditioning, you all heard that in undergraduate, by Skinner, B.F. Skinner, and what he said was behavior that operates on and changes, it operates on the environment and it changes the environment. And there's something called positive reinforcement, and this is a rewarding reinforcement. Behavior change, which is the response, is followed by a stimulus that is rewarding. So the rewarding stimulus, the stimulus is rewarding, and that creates that positive change in behavior. Then there's negative reinforcement, and what this is reinforcing behavior by stopping an aversive stimulus. Punishment is a negative stimuli that decreases behavior. So when this is being administered, it's really about trying to decrease a certain behavior. And then you have what's called token economy. And this is a contingency management system, and it's an exchange system, an exchange or reward system where tokens are given as a reward for a desired behavior. You often see this with young children in certain school settings, the token economy system in order to achieve behavior change for the children on a basic reward system. Some of the theories of learning that you should review in some of the materials, I'm touching on them, but you can read through them and review them. Piaget believed that all children develop according to 4 stages based on how they see the world. That was Piaget's belief. Social learning theory was developed by Albert Bandura, and it focused on the motivational needs and drives. Bandura believed that learning happened through observation and reinforcement, role modeling. So that role modeling of parents, caregivers, was really considered to be critically important. And the reinforcing of behavior, reinforcing of positive behavior is what he considered to be really important. On the licensing exam, there will be some questions. Probably some of the vignettes will focus on child development. So there's a few areas you want to think about. And physical development refers to changes in the body stature. So height, weight, bone development, muscular development, and coordination, which includes motor skills, are examples of physical development. And there are certain normal developments that the child should go through, and it's important for us to understand that. Intellectual development is the ability for the brain to receive, interpret, and send messages and gain the ability to reason. So it happens over a period of time that the child grows and develops, and the brain and the intellectual capacity grow and develop, and they're able to reason as they move along. Social development is the process of learning how to relate and interact with others. And we know how very important this is in life to adults as well. people that research tells us that people that get along and interact and have good interpersonal relationships do better in life in general. Emotional development is the process of learning to recognize and express one's feelings and learning to establish one's identity and individuality, which is what Erikson talked about. So if we think about emotional development, that level of self-awareness, there's a lot of research and writing now about what we call emotional. You have intellectual IQ, but they talk about emotional IQ as well. The ability to understand and to recognize other people's feelings and to respond in a certain way. Moral development is really the gradual process of developing beliefs on right and wrong. So a very young child is not far along in development of moral development. As they grow, they begin to know what is right and wrong. And this is an important stage of development for children. So when we think about child development and assessing, there are certain considerations that would be important. And Sophie Jean-Gillespie, who has done a lot of work in this area, talks about some things to consider for the licensing exam and for your practice in general. And so some of that is stuttering is not a problem until after age 5. So what do we mean? If a family comes in to see you and they're very upset that their child at 2 or 3 who's talking is stuttering, what you want to remember and point out to the parents is this is often a very normal stage of the development, and approximately age 5 is when you begin to be concerned. Now, that does not mean that you might not acquire some early intervention services for the child, but in general, you want to keep this in mind. Stealing is common from ages 5 to 8. You still want to be teaching the child, and you don't want to reward the child for stealing. However, when you see small children steal at this age, it is not so unusual, and you need to work with the child. It does not mean they're going to move on to become a sociopath. Generally, it's not normal to wet the bed after age 3 and a half. Up until that point it is. Now some children have physical difficulties or physical issues that might cause them to bedwet. And so even after that age. So you're always going to be referring to get a physical if a child is bedwetting. But just so you know, up till age 3 and a half, it's very common. And we know that there are certain techniques such as not giving a lot of fluid right before bed and so on and so on. Children of all ages may need funerals or wakes to be explained to them. It is really confusing at times to children, and so according to the age of the child, and different cultures and ethnicities have different beliefs about when to bring a child to a funeral and when not. So that is a personal or cultural decision, a family decision. But if a child does attend, it's important. I can give you a personal example of my brother and his wife. His wife's grandmother died, and their child was about, I would say, 5 years old, and they did bring her to the wake. She barely knew what was happening. She was playing around, and all of a sudden, she said, "Nana, wake up," because she saw that her grandmother, to her grandmother was sleeping. So that's just a small example that I experienced personally, but it's important to explain to children. You may need to explain a few times, but at the developmental level that the child is at is always important. Ages 3 to 6 may believe that a parent they are separated from no longer loves them. So if a parent is really ill or is hospitalized, it's really important to keep going. Let the child know the parent loves them. If the parent or significant person is able to talk on the phone to them, if they can't see them in person, that would be important. Age 5 to 7 are generally aware of conflicts, but still tend to believe they cause the fights. So that if there's a fight between the parents and the child observes it, and they may internalize this and believe they caused it. Very important to reassure the child and tell them it's not about them. We know that even much older children, if there's fighting in the home, if there's a divorce, children tend to blame themselves. So it's important for the adults in the situation to reassure the child. And then just your basic, children usually walk by one or talk by two. However, that is not true of all children. Perfectly healthy children may not walk until 18 months, may not talk. A good example is a child who's raised with older siblings. Why do they need to talk? All they need to do very often is point, and their every wish comes true. So you see that sometimes with children. So it's not, of course you should check it out, but it doesn't necessarily mean that the child is not developing very well. I have known of children who didn't talk until they were 2.5, and they are very successful adults. So that when we talk about assessment, we need to assess each child and each human being as an individual, looking at normal developmental milestones and stages of development, and also looking at that person as an individual. There are some gender considerations in assessment of children. One is that girls are more likely to act out sexually than boys. Girls are more likely to develop eating disorders. However, let me just say that boys develop eating disorders as well, and boys act out sexually also. There's a lot of pressure in society for young girls, but also for boys, to be thin, to look a certain way, to wear certain types of clothes. And so eating disorders, which are not really about food, they are about feelings. And so anorexia is just the flip side of binge eating disorder or of bulimia. So that it's important to know this affects girls more often, but it can affect boys as well. Boys have attention deficit hyperactivity disorder, abbreviated ADHD, more often than girls, and studies show that boys are more aggressive than girls. So that may very well be that we're structured biologically different. However, also boys are trained in society, so to speak, to not show their feelings, not to cry as much, and to be more active. And girls are allowed to show their feelings much more so than boys, but they're not allowed to act out aggressively in the same way. You know, boys will be boys and girls will be girls. And so those are stereotypes, but there is some truth to them, and research has proven it out. So let's talk about gender for a moment. Sex refers to the biological aspects of being male or female. Sex differences are purely physical differences. Gender refers to the psychological and socio-cultural meanings added to biological sex. Gender differences result from people's thinking about their gender. So they may physically have a certain sex, be born into a certain sex, and have certain physicalities. However, they may think of themselves as a different sex. And that's what we refer to as gender. Gender identity is your personal sense of self as a man, boy, or a woman. Gender role is everything that you feel, think, say, and do that shows to yourself and others that you are a man or a woman. Gender role stereotypes, and we have many of those in our society, are oversimplified, very rigid beliefs that all members of a sex have distinct behavioral and psychological and emotional characteristics. We know today that that is rigid and they are stereotypes. Grief and loss. Bereavement. What's bereavement? Well, it's a period of sorrow following the death of a significant person. Loss, on the other hand, is real or perceived deprivation of something deemed meaningful. It could be regarding a death, or it could be non-death related. But the person is experiencing a loss of something that meant something to them. Grief is an emotion generated by an experience of loss characterized by sorrow and or distress and the personal and interpersonal experience of loss. coping. Time-limited reaction in which an event is endured or momentarily managed with coping skills. So we all have coping skills, and they can be developed, and they help us to cope. In times of loss, when we lose somebody who's very significant in our lives, our coping skills usually come to the surface and kick in so that we're able to deal with it. However, it's also very important to remember that grieving a significant loss such as a death is a very, very important thing. There is no time frame on grieving, because I may grieve a loss and it may take me a lot longer than someone else, so there's no time frame. But there are coping skills that help us get through it. Loss adaptation is the process of adjusting to loss and going through the grieving process. And what that does is that it frees up energy for us to then invest in our lives going forward after adjusting and grieving a loss. When we think about cultural competence, what do we know? We know that that is the knowledge of a client's culture and customs, and that people come from diverse cultural backgrounds. So that there are three aspects of cultural competence. One is the need to understand and take responsibility for our own beliefs and attitudes. We've tried really hard here at Fordham to help you all to look at your own, to take responsibility for your own beliefs and attitudes, and the importance of recognizing our own biases and not to allow that to impinge on our work as social workers. The need to learn about and expand multicultural experiences. So how do we learn about a person's culture? Because there's no way that we can understand every single culture of every person that we will come in contact with in our professional career. But one of the best ways is to ask the person about their culture, to let them know we're really interested in learning about their culture. The other is, of course, through research, through learning, gaining knowledge. It's very, very important. Using our knowledge to become proponents of multiculturalism, so that the more we learn, the more we are advocates for the importance of cultural competence for all social workers. The NSAW Code of Ethics includes a special section on cultural competence and social diversity. And I urge all of you, it's a little booklet, you can download it online for free. Be familiar, read through 2 or 3 days before the exam, the Code of Ethics. And it's important, especially focus on this particular section. Cultural, racial, and ethnic identity and development. Identity development is really a series of stages everyone goes through to determine who they are as an individual. A sense of group or collective identity based on one's perception that he or she shares a common racial heritage within a particular racial group is how we develop our racial identity. Racial identity development concerns the psychological implications of a racial group membership, that is, belief systems that evolve in reaction to perceived differential racial group membership. Now let's talk a little bit about abuse and neglect. And the World Health Organization came up with a definition in 1999, and this is what it says. Child abuse or maltreatment constitutes all forms of physical and/or emotional ill treatment, sexual abuse, neglect or negligent treatment, or commercial or other exploitation, resulting in actual or potential harm to the child's health, survival, development, or dignity in the context of a relationship of responsibility, trust, or power. There's no single cause. That's what research tells us. Some of them are stressors, a history of abuse, lack of social supports, severe financial issues, low self-esteem. Family issues such as marital discord or domestic violence. What's important to understand, as Dawn Apgar points out, is that the victim is very often blamed by the perpetrator, which is a way that the perpetrator, in their own minds, are able to make it okay. It wasn't the perpetrator's fault. They blame the victim. Child abuse occurs when the parent, guardian, or other person responsible for the child's welfare. It inflicts or allows to be inflicted upon the child physical or mental injury, or engages in acts or omissions that present a substantial risk of physical or mental injury to the child, including injury sustained as a result of excessive corporal punishment. Physical injury means death or permanent or temporary disfigurement or impairment of any bodily organ or function. What are some of the indicators of child abuse? Unexplained or poorly explained injuries. It could be bruises in the shape of objects, cigarette burns, or bite marks. This should raise particular concerns for social workers, school personnel, or adults in general. Changes in behavior, such as if the child becomes suddenly withdrawn, angry, aggressive, anxious, or depressed. If the child regresses to earlier behaviors, such as thumb sucking, bedwetting, or fear of the dark or strangers. Now, children who are under stress could revert to some of these behaviors, and it might not be that they're being physically abused. However, we always want to be keeping this in mind. Changes in appetite or signs of a sudden eating disorder. And becoming very, very wary of adults. All could be indicators of child abuse. What are some of the indicators and dynamics of psychological abuse? Well, psychological abuse is a chronic pattern of behaviors such as belittling, humiliating, shaming, or ridiculing a child. Emotional abuse includes the failure of a caregiver to provide an appropriate and supportive environment. Such acts as restricting a child's movements, denigrating a child, ridiculing them, shaming them, making threats or intimidating a child, discriminating, rejection, and other non-forms of hostile treatment, all are indicators of psychological abuse. And psychological abuse can be extremely harmful to a child. As physical abuse can be, psychological abuse can be very, very detrimental to the child's well-being. Now, neglect. Neglect refers to the failure of a parent or caregiver to provide for the development of a child, when the parent is in a position to do so. And that's what I really want to stress. Neglect is about failing to provide the care needed for the child to develop when the parent has the resources and is able to do so, but does not. It occurs in one of the more following areas. It could be health, education, emotional development, nutrition, shelter, and safe living conditions. Neglect is distinguished from circumstances of poverty in that neglect can occur only in cases where reasonable resources, as I said a few moments ago, are available to the family or caregiver. So this is the end of Module 2. Thank you so much for listening. And if there are any questions or concerns, in Module 1, all of my contact information is included. Thank you.